pediatrics residencies have a duration of 3 years, and PRI's curriculum really encompasses a number of experiences during those 3 years, certainly meeting all of the ACGME minimum requirements, but having some unique facets also. So among the ACGME requirements, our residents currently do 6 to 7 blocks, 4-week blocks of inpatient pediatrics with the pediatric hospitalists. They spend a minimum of 3 blocks doing pediatric ED. And then built all around all of this is a solid amount of time also in their continuity clinic here in this clinic. They end up spending a total of about 4 total blocks in their continuity clinic, really learning to be outstanding general pediatricians and also developing really strong skills in efficiency and office-based management of both sick and well children.
So their weekly or regular clinic that they see their own patients will be at a federally qualified health center in Boise. They'll also get the opportunity to rotate at St. Luke's Children's Hospital, which is where they do pretty much all of their inpatient rotations. They'll get to work with subspecialists in subspecialty clinics. They'll spend time in both urban settings and rural settings.
The inpatient pediatrics experiences are typically set up where the overwhelming majority of a resident's time is on that specific experience, whether it is inpatient pediatrics / pediatric hospitalist, or whether it's pediatric ICU or neonatal ICU.
Inpatient medicine is a really fun medicine to practice. It's busy, it's challenging, and we want our residents to experience that efficiency and level of skill that they need to have to kind of manage multiple patients in an inpatient setting, whether that's in the emergency department, on the general pediatric floor, in the pediatric intensive care, or the neonatal intensive care units. These are going to be very busy environments, collaborating with lots of ancillary staff, nurses, one-on-one with your attendings.
We do have a few experiences where we have 24-hour call. So in the pediatric ICU and the neonatal ICU, there is 24-hour call, typically about 3 of those per 4-week block. And we feel that those are important for 2 reasons. One is I personally feel like it's incredibly important for a resident to learn how to think when they've been working for a longer period of time, how to think when they are potentially a little bit more tired, and perhaps most importantly, to see the evolution in some of these critically ill children and how they improve, change, maybe worsen during a more prolonged period of time. That's super important for education, and it's super important to have perspective and recognize one's limits also when you get out into your own practice.
Well, here in clinic, they'll work with a nurse. They'll have a particular nurse assigned to them, and they'll work very closely as a team to take care of the patients they see. They'll also have an experienced pediatrician who supervises them as they see patients in clinic. We usually arrive around 8 in the morning. We review the schedule for the day. You meet with your nurse team, kind of review each patient, have a plan for the day. When they're early in their residency, they have maybe 3 or 4 patients per half day. So they have plenty of time to work through it. After they see the patient, they come tell someone like me, this is what I've learned. And we'll either say, that was fantastic, or maybe we should go back and ask these other questions. So it's a very collaborative experience. As they progress through residency, by the end, our graduating seniors see the same schedule that I would in my own clinic.
I think there's a lot of different things that are very unique about this residency. First and foremost, we have a lot of emphasis in our curriculum on rural rotations as well as advocacy, which is pretty unique. A lot of programs have like an advocacy day or a week of advocacy. We have 2 full rotations that are catered around advocacy and community pediatrics. And so we go to the legislature, we talk about different bills, we talk about ways in which healthcare workers, pediatricians can be involved in lawmaking. And then we also have our rural sites where we go out and rotate with different rotation leads and help cater communities in the local areas, which is also a very unique opportunity.
This is a great choice if you want to go rural and do full scope, because it really does have that full scope learning opportunities. You're not pigeonholed into you should go into fellowship. If you want to do fellowship, you can do it from this program. There is opportunities for that. In fact, I almost did PICU fellowship. I was really interested in it, and everybody jumped on board and was like, yeah, how do we get you there? And so people are willing to do that. And also, if you're wanting to go rural, it's really, really, really great training for that.
Each resident will end up spending a total of 2 weeks during their first year, 4 weeks during their second year, and 4 weeks during their third year in a rural community learning rural pediatrics and all facets of that.
Every month we switch what we do. So it's all within the realm of pediatrics or working with children in one way, shape, or form. But every 4 weeks we switch to something different. So whether it's at the hospital, whether it's in a clinic setting, whether it's within one of the subspecialties, or in the ER or in the ICU setting, those responsibilities day to day does change, but it's all surrounding just the health of children.
I think that residents who choose our program will find that they really get incredibly broad exposure and really can go out and do anything afterwards. I feel like our residents who graduate from this program are incredibly well prepared to be out in a rural community or in a large city as a general pediatrician. I also feel like the training that they get prepares them very, very well for a fellowship if they choose to go into a pediatric subspecialty.